Hi everyone, welcome to West Virginia Junior College Bridgeport campus. While cold and flu season is upon us, let's talk about a procedure you may see performed or have done to you in a medical facility. Today on campus, we have a clinical medical assisting student, Kellie Middleton, who will be performing a rapid mononucleosis test.
Hi, I'm Kellie Middleton, and I have my patient with me today, Mackenzie Wright, and I'm going to be performing a rapid mono test. The first thing I would do would be to pick her finger, and you usually use the third or fourth digit on your hand, and I'm going to go with the third digit. And I'm going to use my alcohol pad and clean her finger. And we will allow that time to dry so that the alcohol doesn't interfere with our test results. And while doing that, I'll get all my other stuff together. And now I have my lancet, and I will take Mackenzie's finger, and you want to poke toward the side of the finger. And what you want to do is the first drop of blood, you want to wipe it off. And we take our pipette and we stick it to the blood and allow it to fill up to the little black lines that are marked on the pipette. And I will place a gauze over Mackenzie's finger for her to hold on there. And I have my mono cassette here, and so we will squeeze the blood onto the cassette, making sure that it's coated. And we have our mono developer solution. We open it and we add 2 to 3 drops. And we allow it to sit for 5 to 10 minutes so that we can get our test result. Hi, I'm Kellie, and we're back. And as you can see, we have Mackenzie's test results for her mono test. We have 1 line, that's an indicator that it's negative. If we'd have had 2 lines, it would have been positive, and if we had no lines, it would have been an invalid test, and we would have had to repeat her test.